Are you aware that stroke is not only the fifth most common cause of death, but also a leading cause of long-term disability in the United States? Keep watching, because in this video we discuss strokes and how you can protect yourself and loved ones. Welcome, thriving beings, to this critical discussion about strokes. A stroke is like an unwelcome attack on the brain, and it's essential to know the ins and outs to protect ourselves and our loved ones. Now, let's get down to the basics. There are two main types of strokes to be aware of. Ischemic stroke. This occurs when a clot is blocking the blood flow to the brain, cutting off the oxygen supply to affected brain cells. Hemorrhagic stroke. On the other hand, this happens when a blood vessel bursts, causing bleeding into brain tissue and damaging those precious brain cells. Know that a stroke is a medical emergency. It demands immediate treatment because without it, brain cells are deprived of oxygen, leading to permanent brain damage that can affect bodily functions controlled by those brain cells. Can there be warning signs days before a stroke happens? That's the question on our minds, and the answer might surprise you. While it's true that we can't always predict when a stroke will strike because stroke symptoms often seem to hit out of the blue, there are cases where our bodies send us signals that should not be overlooked or ignored. Tune in as we take a look at 5 common warning signs. Number 5. Numbness or weakness in one half of your body. This is a significant red flag that might emerge in the days leading up to a stroke. It's like your body's way of dropping a hint. The interesting thing is that this numbness or weakness can actually help determine which half of your brain is under attack. Here's the key. One side of your brain controls the opposite side of your body. So if you're experiencing numbness or weakness on the left side of your body, it could be an indicator that something is going wrong in the right side of your brain, and vice versa. Number 4. High blood pressure or hypertension. High blood pressure or hypertension takes center stage as the primary risk factor for strokes, and it's like the silent partner we never asked for. Imagine blood pressure as the force with which your blood presses against artery walls, all orchestrated by your heart's rhythm. Typically, we aim for a blood pressure around 120/80, but when those numbers consistently soar above 140/90, it's a clear sign of high blood pressure. This condition isn't just about numbers. It's a subtle reminder that our blood vessels, including those linked to our brain, are at risk. High blood pressure means our hearts have to work harder to maintain circulation. Now, here's where the plot thickens. High blood pressure and strokes are old pals, but not in a good way. High blood pressure weakens vessel walls, accelerates common heart issues, and can lead to the formation of clots or plaques that block blood flow to the brain. The higher the blood pressure, the higher the risk of stroke. It's a call to action, a reminder to keep those numbers in check. Understanding why high blood pressure knocks on our doors involves a mix of factors: family history, aging, weight, lifestyle choices like smoking and a salty diet, and even diabetes. But fear not, because we hold power over this situation. Regular check-ins with the doc, lifestyle changes including exercise and maintaining a healthy weight, these steps are our weapons in the battle against high blood pressure and its ominous connection to strokes. Number 3. Sudden trouble seeing in one or both eyes. Your eyes can also be messengers when it comes to warning signs of a stroke. If you suddenly experience trouble seeing in one or both eyes, it's a cause for concern. But here's where it gets critical. If this temporary blurriness or reduced vision is due to an oncoming stroke, you may only have a few precious hours to get emergency care before the stroke actually occurs. It's like a flicker in your vision, as if a window shade is coming down or going up. These symptoms last only a few minutes before your vision returns to normal. The danger here is that because it's brief and your vision quickly goes back to normal, many people tend to ignore it, thinking they're in the clear. Number 2, a severe or unusual headache. Now, here's something quite intriguing. Although this doesn't apply to all stroke cases, in some situations a certain kind of headache may be an early indicator of a pending stroke. In a 2020 study of 550 adults, they discovered something called a sentinel headache that preceded an ischemic stroke in 15% of study participants. What's a sentinel headache, you ask? Well, it's defined as a headache that occurs before an event, in this case, about a week before a stroke. The authors of the study noted that these headaches were either severe in nature or different from any previous headaches the individuals had experienced. Furthermore, these headaches often started within 7 days of a stroke and frequently persisted until the stroke symptoms occurred. Intriguingly, those who had sentinel headaches before a stroke were more likely to have had atrial fibrillation, which is an irregular heartbeat and usually a rapid heart rhythm, compared to those in the control group who didn't have a stroke. Moreover, a sentinel headache is also considered a sign of an impending aneurysm rupture, in which a blood vessel swells or bulges and then bursts, a potentially fatal condition. The takeaway here is clear. It's essential to take any unusual or severe headache seriously, because it could be a predictor of a more serious health event. Number 1. A transient ischemic attack, TIA. Here's another indicator when it comes to stroke warning signs, the transient ischemic attack, or TIA, often referred to as a mini stroke. So, what exactly is a TIA? It's when the blood supply to part of your brain is interrupted, but only for a short period of time. The catch with TIAs is that their symptoms can mimic those of a full-blown stroke. However, the difference lies in the duration. The symptoms of a TIA typically disappear within an hour and rarely cause permanent damage. Yet in some cases, these symptoms can persist for up to 24 hours. These symptoms include the symptoms mentioned earlier, such as numbness on one side of the body, sudden confusion, or vision troubles, dizziness, etc. What's vital to understand is that even though the symptoms of a TIA are transient, it's crucial to seek medical attention, and even if the symptoms go away on their own. Why? Because a TIA usually serves as a warning sign that a more severe stroke might be waiting down the road. In fact, statistics show that approximately 1/3 of people who have experienced a TIA will go on to have a more serious stroke in the future. However, here's an interesting twist. Recent studies have revealed that the number of people experiencing an acute stroke within 90 days of a TIA has actually decreased in recent years. This could be a clear indication that the preventive measures taken following a TIA are effective at warding off a more severe stroke. Now, you might be wondering, what exactly are acute strokes? Let's break it down. Acute ischemic strokes are a type of stroke when the blockage in a blood vessel is sudden and results in immediate, often severe stroke symptoms. They are a medical emergency and require urgent attention. Remember the acronym FAST to recognize stroke symptoms. Now that we've uncovered the potential warning signs, let's equip you with a tool that can make a life-saving difference. It's called FAST, and it's the most common and easily remembered acronym to help people recognize the symptoms of a stroke and act accordingly. F, face drooping. This is the first letter in FAST, and it stands for face. If you or someone you know suddenly has their face start to droop or go slack on one side, it could be a strong indicator of a stroke. A, arm weakness. Moving on to A, which stands for arm. But here's the thing, this weakness applies not just to your arm, but also to your face or leg on either side. If you or someone you're with experiences weakness in these areas, it's a warning sign to take seriously. S, speech difficulty. The S in FAST represents speech. If you find that your words are slurred or jumbled and you're having trouble understanding others or making yourself understood, this is a significant symptom that shouldn't be ignored. T, time to call 911. Lastly, T stands for time. If you or someone you know is experiencing any single one of these symptoms, face drooping, arm weakness, or speech difficulty, it's time to call 911 immediately. So remember FAST, because it's a tool that can help you recognize these symptoms and act quickly. How can you reduce your stroke risk? While it's true that you might not be able to completely prevent a stroke, you can take proactive steps to significantly reduce your risk. Here are some essential preventive measures. Number 8, balanced diet. Adopt a diet that limits saturated fats and cholesterol. Opt for fruits, vegetables, whole grains, and lean protein. A balanced diet plays a significant role in maintaining good health. Number 7, stay active. Try to exercise on all or most days of the week. Physical activity not only keeps you fit, but also helps manage your blood pressure and cholesterol levels. Number 6, maintain a healthy weight. Keeping a moderate weight is beneficial for your overall health. It reduces the strain on your heart and blood vessels, lowering your risk of a stroke. Number 5, monitor cholesterol levels. Get to know your cholesterol levels and have them checked at least every 5 years. High cholesterol levels can lead to the buildup of plaque in your arteries, increasing your stroke risk. Number 4, control blood sugar. If you have diabetes, closely monitor and control your blood sugar levels. High blood sugar can damage your blood vessels and increase the risk of stroke. Number 3, check for heart issues. It's essential to get checked for any heart issues, and if necessary, follow a treatment plan as recommended by your healthcare provider. Heart problems can contribute to stroke risk. Number 2, quit smoking. If you're a smoker, consider quitting. Smoking not only damages your lungs but also narrows your blood vessels and increases the risk of clots. Number 1, maintain healthy blood pressure. Keeping your blood pressure within a healthy range is crucial. High blood pressure is a leading risk factor for strokes, so regular monitoring and management are key. And there you have it, an exploration into the world of strokes and their potential warning signs. Remember, stroke symptoms may seem to strike suddenly, but in some cases there are crucial warning signs that should not be ignored. If you found this video helpful and informative, please give it a thumbs up, share it with your friends and family, and hit that subscribe button so you can stay updated on our latest health and wellness content. Thanks for watching.